Lay you down on your stomach and I grab your ankle and try to bend your heel towards your glutes. That heel should go within about 6 to 10 centimeters of your glutes. When's the last time you spent some time kneeling where your leg was in full flexion? When's the last time you spent full time with your hip in range of, full hip extension?
So Dr. Kelly, there is a visible sign of aging which I have seen in retired athletes also, and also a normal recreational athlete also, which is the progressive deterioration of his knee health. So I want to know specifically about knee and the range of motion which is strictly restricted as we age. So what do you think is the cause of this and how we can reverse this after that? Because I think you have also made your one knee is, I think, a knee replacement, right? If I'm not wrong.
Yeah. One of the things that we see in a general population health is that osteoarthritis is really a metabolic disease. And that constant inflammation, constant high blood sugar, high A1C, all of these markers tell us that our tissue health isn't as readily normal. And what goes along with that tends to be decreases in activity. So we have this sequela of biomarkers, which is hard on joint systems, tissues, and then it also is paired with less activity, poor nutrition choices, high levels of stress. And so what we first and foremost was we say, okay, those are complicated behavioral changes, right? And that's why your physician, who only has 6 or 8 minutes of time with you, is really trying to get you to do some things. We need to eat more fiber. We need to eat more fruits and vegetables. We need to get enough protein, right? We need to get enough sleep. And you shouldn't have to talk to your physician about any of those things. Those are the things you learned when you were a child, growing up. And yet those things alone, if we just got people doing a better job, not even the perfect job, but a better job. You don't have to be a monk eating an austere meal with your hands. It could be instead the fact that, we're trying to eat like human beings eat. And again, notice we may have very different diets, but at the root of our diets, whether I'm a vegetarian or not, is protein, is vegetables, is fiber, right? We don't see a lot of sugar. Sometimes sugar is fun, but it's probably not all the time sugar. Unfortunately, chai is very delicious when it's very sweet, but you should probably not have very, very sugary chai all day long. Sorry, chai wallas. So here's the key here then is we can say, okay, there's a whole host, if we're talking about joint health, we want to make sure that we're keeping an eye on environmental behavioral health. And then the other side of this is asking, why can't that knee flex all the way? So if I lay you down on your stomach and I grab your ankle and try to bend your heel towards your bottom, towards your glutes, that heel should go within about 6 to 10 centimeters of your glutes. That tells me that I have enough range of motion in the tissues for the knee to flex. Now look, if I can't do that, it's rare that that's a knee problem. It's a system problem. And if your quads are stiff, if you don't have access to the native just background range of motion, it's going to be very hard to move, which changes a lot of the profiles of loading on the knee, which means that our knees may just be living this little tiny range of motion window, and we don't have access to greater range of motion. That those forces might be very specific and very high or higher in positions that aren't as effective. If I certainly turn my feet out when I walk, because I've been wearing slippers my whole life, then all of a sudden, imagine taking your tibia and just rotating it 15 or 20 degrees out. And now I have a knee that doesn't always work like a knee. I have a knee that's sort of stuck in an open position all the time, which means I'm changing how the condyles of the femur are interacting with the tibial plateau. I'm changing ideal positions of loading on the meniscus. I'm suddenly changing how my calf is functioning and how my hamstrings are functioning. So if you're walking like a duck all the time and your lateral calf or outside of your hamstring is tight, one of the things we'll say is, well, hey, we understand that you may have to squat deeper with your feet turned out. There's no reason why you can't practice walking with your foot straighter, right? Because that hints at better physiology. And I think as we talk about these things, we want to say that it's good that we have all these movement solutions and these problems, right? We want to be able to solve problems of movement with as many solutions as we can. But not every solution transfers most effectively. Not every solution handles force as effectively. Not every solution gives us power in those positions. So what we could start to do with the knee is, first of all, say, well, when's the last time you spent some time kneeling where your leg was in full flexion? When's the last time you spent full time with your hip in range of, full hip extension? And when we start to ask the questions about restoring native ranges, we tend to see that the knee does a lot better. Your joints are designed literally to last 110 years, no problem.
Okay.
You're going to wear out your gonads for sure. Your gonads will wear out. Your sex organs will wear out, right? You won't make as much testosterone when you're 110 years old, but your joints are designed to go the distance for 110 years old. So I just want everyone to understand that, if you're 20 and your knees are shot, that is because your knees can't put up with your crap anymore. And that your eating, your movement, like what you're doing is, you've really worn out your body, and you've sort of leveraged its incredible tolerance and its ability to buffer silliness for decades and years before it raises its hand. I had a knee replacement because I crashed going very, very fast and ended up putting my femur through my tibia. So I had 2 gigantic bone lesions that I was able to manage for a long time until I wasn't able to manage. So I had an injury, trauma to the joint that was interacting or interfering with my ability to use my body in the way I wanted, and a knee replacement or knee resurfacing was the best solution.
So for example, let's say there is a person who is not having a good range of motion when it comes to his knee. Then how he can strengthen his knee movements, range of motion, as well as the complete knee fitness in terms of mobility and flexibility. Let's say you told that you have to take care of the metabolic stuff first of all. Let's say he has taken care of his nutrition, stress, sleep and all that. And now he just has to figure out the exercise domain. Like he has to do the split squats, or what are the other exercise practical implementations you would like to give him?
What's nice about this conversation is that we can start to say, well, what do you like to do, right? And when we ask that question, remember, I coach many Olympians over many years. I work with elite rugby, elite football, American football. I see a lot of different ways the athletes are using their bodies. The most important thing that you can do for exercise is the exercise you enjoy doing. But if you don't touch those normal ranges in that exercise, and again, you may have to do a little bit of strength training on the side. If you wanted to just do range of motion, I would say go do yoga or Pilates. I guarantee you're going to touch all of those shapes in those practices. Very excellent practices. If you want to get strong, yoga and Pilates is not the solution, right? You're going to need to swing a kettlebell or swing an Indian club or do some kind of resistance training through a bigger range of motion. But really, let's talk about what the body does. In the lower body, the hip and the leg don't do that many things. They squat, right? And then they lunge. We get into a tandem stance. And suddenly that creates enough of a movement language where any exercise that we do in the gym, not ideally, but will fall into one of those 2 shapes. So if you say squatting or deadlifting, those 2 shapes are basically the same. Picking something up off the ground or moving my body up and down. The difference is the degree of knee bend. Stepping up on a step. That's a different squat, but on a single leg now, right? A lunge suddenly may start to expose that tandem pattern, that pattern where I'm in a lunge shape. So what we can do is we can look at your movement language for the day, or certainly we can do this in your strength training language. We can look at the exercise you're doing and ask, are you exposing yourself to these fuller ranges of motion? And if you're not, where are you touching them? And it could be in a mobility practice. It could be sitting on the floor. Again, you might be a runner who does a little bit of squatting to make yourself strong, but then you have to have a movement practice to keep an eye on your range of motion. And I think the problem with modern fitness is that we said as long as you go really hard on the exercise bike, that's enough. And it's not enough, right? So what we see is that it certainly is not enough. So what we have to ask is, what's a more complete practice? Well, it's a practice that begins to show, or at least expose my tissues to a fuller range of movement. And they don't have to be heavy necessarily or fast necessarily, but I need to be able to do that. So there needs to be some kind of squat, some kind of single leg work. There needs to be something that looks like it rhymes with hip extension drills and lunging. And suddenly, If I'm on a rowing machine, for example, that's a lot of deep knee bends. That's a lot of knee flexion. And I may not have to then, if I'm rowing 30 to 40 strokes a minute, I may not have to ever touch those deep knee flexes. I might be able to just swing a kettlebell because that's my strong position, but I've touched this range of motion in my aerobic work. And so suddenly we see that we can get a lot of movement in some of these aerobic positions and aerobic work.
दोस्तों ये वीडियो अगर आपको वैल्यूएबल लगा तो इसे लाइक कर अपने सारे दोस्तों से इसे शेयर कीजिएगा। इस चैनल को सब्सक्राइब तो आप कर ही लेंगे। चलिए मिलते हैं।